Hello friends, as we discussed in our the last video, the treatment of muscle invasive bladder cancer, in which we opted the patients with a radical cystectomy with construction of ileal new bladder and are the ileal conduit. लेकिन कुछ ऐसे भी subset of patients हैं where we cannot actually do a radical surgery, and those are the patients who are unfit for the surgery, or the patients who are very elderly and their longevity of life is not more than 5 years, and the patients who are not willing to lose their bladder. So this is also one small subset of patients where we cannot force the radical cystectomy as a treatment of option. However, I must stress here that radical cystectomy is the gold standard when it comes to the muscle invasive bladder cancer treatment. Now, the alternative for these set of patients is bladder preservation protocol. We follow, when we say that bladder preservation protocol means BPP, means that we had to do a radical TURBT. A radical TURBT का मतलब है कि सबसे पहले as a surgeon, what I would do that I would put an endoscope and try to resect the complete wall of the bladder जहाँ पे कि tumor है, and so much that I will actually goes outside the bladder to see the fat around the bladder. So that is called the radical TURBT. Even there are certain very specific indications also for the patients who can be opted for these treatments, like अगर आपका tumor एक single tumor and it is not involving the ureteric tubes and it is amenable to radical resection, and afterward, once we have done this, the patient should be ready to accept two other treatments. यानी कि रेडिकल TURBT के बाद में chemotherapy and radiotherapy. So all the three treatments are given to these patients to achieve the complete resolution of this bladder tumor. However, as I said just now, that radical cystectomy is the ideal treatment for these patients. So these patients also have another very much stringent follow-up, that every 3 months we had to resect that area and send for the histopathology and to find out whether there is any residual tumor or not. And at the same time, we had to do the imaging study to find out whether is any disease focus has gone outside in the blood or distant metastasis. So the follow-up is very stringent. The treatment is very, exhaustive. You had to have a surgery, you had to have a radiation, you had to have a chemotherapy to actually match the results of radical cystectomy, still not matching with the radical cystectomy as a treatment of choice for the muscle invasive bladder cancer. So these are very small set of patients who are not willing for the surgery, are not fit for the surgery, or they are not fitting into the criteria of muscle invasive. This is one option available for them to have this treatment for muscle invasive bladder cancer. मुझे उम्मीद है कि ये वीडियो आपको पसंद आया होगा और आपके लिए यूजफुल रहा होगा. थैंक यू वेरी मच.